Hello everybody, my name is Steven Roluski, and today I'll be giving my persuasive speech on medicinal marijuana. Now I want to start this off by saying I don't want to be misinterpreted and be, sound like one of those guys that, legalize marijuana, because that's not what I'm going for here. I'm more towards the medicinal side. Marijuana has proven to have a lot of positives that can help the community, and I will go through some of them and hopefully persuade you to see my point. Now, marijuana can treat glaucoma, which is a disorder in the eye. I don't really know much about glaucoma, but it's one of the many uses it can treat. Uh, it can, there might be a chance it can reverse the carcinogenic effects of tobacco and improve lung health. They believe that with the deep inhales that you take when smoking marijuana, it can improve lung uh, use. Now, I'm not saying, obviously, once again, smoking. I believe smoking anything's bad for you, so I don't foresee this one. But I mean, there's been studies on it. Uh, Actually, there was a study and published in the Journal of American Medical Association in January 2012. Marijuana did not impair any lung function and can increase the lung capacity. I mean, take it for what it's worth. It can help control epileptic seizures. Now, this one's a sensitive subject to me because my daughter suffers from epileptic seizures. It's not an easy thing to deal with, and me personally, as a father, it's hard to see your child that's happening to your child, and there's something you can do. Uh, Medicinal marijuana has been proven to help with epileptic seizures by binding to the brain cells responsible for controlling excitability and regulating the relaxation. Uh, Now, once again, I don't want my daughter to smoke pot, but there is many ways they can take the THC and other medical benefits from marijuana and put it into pills and have no effects of being high or anything like that. And that's what I would aim more towards for my daughter. Uh, it can decrease the symptoms of a severe seizure disorder known as Dravet syndrome. Now, there was a girl. I don't know her name, but her family's the Figgy family. She was 5 years old and she suffered from 300 seizures a week. They started giving her medicinal marijuana and it lowered it from 300 a week to one every 7 days. Uh, Now, I mean, obviously it didn't cure everything, but going from 300 to one in 1 week to one every 7 days, that's a huge, huge decrease. And I know once again as a parent, if that was my daughter, I would do everything I could, and if that was proven to help, then I would have done it. Um, there's a chemical in marijuana that has been proven to help stop the spread of cancer cells. It can help decrease anxiety. I don't think I really have to explain that one too much. Oh, THC slows progression of Alzheimer's disease. Now, once again, that's another one that hits home. My grandfather suffers from Alzheimer's disease, and it's really rough to watch how far he's come. He he really doesn't recognize me anymore, or my family, or anything like that. He's just not really there anymore. And if I wish there was a chance that we could have, possibly have been able to get this to him and maybe slow it down or try or something. Just one of those things that if there's a possibility that it could have helped, I would have wished we would have had that option. It it works by slowing the formation of an amyloid plaques by blocking the enzyme in the brain that makes them. And the plaques what deteriorates the brain material. It can ease the pain of multiple sclerosis. Jody Corey Bloom studied 30 patients with painful muscle contractions. They didn't respond to other treatments that were given to them, and only after a few days of smoking marijuana, they began to feel less pain. I mean, once again, take it for what it's worth. I mean, it's a controlled study, 30 people. It's not the biggest study in the world, but it seemed to help. It lessens side effects from treating hepatitis C and increases treatment effectiveness. I guess some of the treatments for hepatitis C, it makes you nauseous and not hungry, and marijuana can help with that at a certain point. It can treat inflammation and bowel syndrome. It can relieve arthritis discomfort. And there was a study done on 2,000 people, and the ones that did smoke marijuana, their metabolism was better. It also, the ones that did smoke marijuana, it made their the way they process sugar in a healthier way. I would think, you know, the people that smoke weed would be a little heavier, but apparently they were all the skinny ones at the testing. It improves the symptoms of lupus, and once again, that's another one that hits for me. I know 3 out of these, it's pretty sad, but my brother suffers from lupus, and it's an autoimmune deficiency. He gets sick really easy. And once again, not saying I want my brother to smoke weed. I'm sure he would love that. But if there's any way that can help, I would gladly look at that option to help him. It soothes tremors for people that suffer from Parkinson's disease. It has been proven to help veterans that are suffering with PTSD. It has shown to help protect the brain after a stroke. And it has been proven to reduce some pain and nausea from chemo and stimulate appetite. As you know, chemo is rough and makes people sick. So that is my presentation on medicinal marijuana. I hope you enjoyed it and hope you learned something. Thank you.